Thank you, the organizer, for having me here today. My topic is clinical case presentation of abduction disorders in China. We all know abduction disorder is caused by the sixth cranial nerve palsy. The sixth cranial palsy is the most commonly affected oculomotor nerve in adults, and in children, it is the second. There are many etiologies such as diabetes, tumor, trauma, inflammatory, and so on. Today, we'll talk about some special case presentations. This is the case one. The right eye cannot move outward, and he has esotropia of the right eye. He is born with this and is stable. The deviation is stable. We look at the peripheral fissure. When the eye look to the left, the right eye, listen, becomes small. The peripheral laser is small. And when he look to the right side, the peripheral fissure becomes normal. What's the diagnosis? Yeah, we all know it's the Duane retraction syndrome. This is the type 1 Duane syndrome. Is the limitation of abduction. Most of them is the type 1. The type 2 is the limitation of adduction. And the type 3 is the limitation of both adduction and abduction. All of three types have global retraction and narrowing of the peripheral fissure on adduction. Yeah, this is the second case. He has left eye esotropia and abduction deficit. What's the diagnosis? Yeah, look at his face. He has the seventh nerve, cranial nerve palsy also. He was born with this kind of situation, and the deviation is stable also. This is the Möbius syndrome, categorized by abduction and facial nerve palsy. It may be unilateral or bilateral. Sometimes there are other abnormalities such as craniofacial malformation, hypoglycemia, limb anomalies, hearing loss, and mental retardation. Yeah, look at this child. He's about 2 years old boy. The abduction deficit of the right eye and the esotropia also. Yeah, look at the CT scan. The right medial rectus muscle is enlarged, and the force detection test show restrictive force of abduction of the right eye. Yes, is the congenital fibrosis of medial rectus muscle. Yeah, what's the diagnosis of this case? He's a middle-aged male, and he had left esotropia for about 3 years, and cannot move outward of the left eye. Look at the picture. Seems he has a proptosis on both eyes, and have up eyelid retraction also, especially the left eye. Look at the orbital CT scan, and many extraocular muscles enlarged, including the medial rectus muscle of both eyes. Yes, this is the xylo-related strabismus. What's the diagnosis of this case? He's a 58-year-old man. He had a history of eye trauma. He slipped down in the office 11 months ago, and the left eye and the right eye cannot move outward, and has a large esotropia also. Yeah, look at the orbital CT scan. He has a fracture of the right medial orbital wall. The medial rectus enlarged at the posterior part of it, so he cannot move outward of the right eye. What's the diagnosis of this patient? He's a female, about 30 years old. In the primal position, he has no strabismus. The right eye cannot move both outward and inward, especially the deficit of abduction of the right eye. When he looks to the right or the left side, he has double vision. Yeah, we look at the MIR scan of the orbit. Yeah, look at the medial rectus of the right eye. It's greatly enlarged, including both the muscle belly and the tendon. The medial rectus muscle causes the palsy of the medial rectus and the restrictive force of the abduction of the right side. So he has both abduction and adduction deficit of the right eye. Is an acute orbital myositis of the right medial rectus muscle. This is the last case. Both eyes in the large esotropia and the hypertropia cannot move a little bit. He has high myopia. Look at the CT scan of his orbit. Both eyeballs dislocated superiorly and laterally. Yeah, it's a myopic strabismus fixus, also called heavy eye syndrome. It's categorized by progressive esotropia and hypertropia with limited abduction and superduction. It usually occurs in high myopic individuals with an axial length more than 27 millimeters. The mechanism is the superlateral dislocation of the myopic globe with displacement of both the superior rectus and the lateral rectus muscles. Summary, we have 3 cases, all of them are special forms of strabismus. The 3 congenital include during retraction syndrome, Möbius syndrome, and the fibrosis of medial rectus. 3 are orbital diseases, including xylo-related strabismus, fracture of the medial orbital wall, and orbital myositis of the medial rectus. The last one is heavy eye syndrome. Thank you.